Hello, my name is Bienz and I am a CR UK funded clinical research training fellow. I started a clinical PhD here at the Heart and Lung Research Institute in Cambridge last year, and prior to this I have been a doctor for almost 10 years and I am training to be a clinical oncologist. So one of the things I love about working clinically in oncology is that the science underpinning the treatments that we give is so interesting and it's rapidly advancing. A large component of my daily clinical work is recruiting patients to clinical trials and also adapting their oncological management based on the rapidly evolving evidence base. I find it really inspiring to see patients directly benefiting from research, and as a result, it was important to me to gain some clinical trial experience. I really wanted to be able to learn how to completely independently manage setting up a clinical study, from running a clinical study, all the way from start to finish. So I'm particularly interested in the development of lung cancer in people who have never smoked. So we're setting up a clinical study that is focused on never smoking lung cancer called Enlighten, and we're opening it across 12 different hospitals in the UK. There is little detailed information about never smoking lung cancer in the UK, and a recurrent question that comes up when somebody is diagnosed with lung cancer having never smoked is, why me? So we're looking to address that by setting up a UK registry of never smoking lung cancer patients with paired blood and archived tissue samples, and also comprehensive environmental exposure data and clinical data. We want to describe this population in detail and the sort of risk factors that they may have, and also we want to think about asking whether it's possible to develop a risk score that could stratify the general population in order to identify those that might be at increased risk of developing never smoking lung cancer. So the first thing to say is that the widely accepted definition of a never smoker is somebody who has smoked less than 100 cigarettes in their lifetime. So 10 to 25% of all lung cancer diagnoses are made in people who have never smoked. And actually, when you think of lung cancer in never smokers as a distinct disease entity, so separate from smoking-related lung cancer, it's actually the 5th leading cause of cancer-related deaths for both men and women worldwide. And in the UK, it's responsible for approximately 6,000 deaths per year. The demographics of never smoking lung cancer differ significantly from lung cancer in smokers. So the majority of cases are in women. They often present at an earlier age, and those with Asian ancestry are at increased risk. And I think it's important to mention that the symptoms are often dismissed by both patients and by healthcare professionals. And as a result, unfortunately, it's more common for people to present at a later stage with more advanced disease. So there are significant gaps in our understanding of never smoking lung cancer, and that's something we hope to address with this study in order to try and help improve outcomes for patients. So patient and public involvement is an essential part of clinical research. It brings a unique perspective that comes from a lived experience of a certain health condition. And by incorporating these experiences, it can help create better quality clinical research by helping design how a study is implemented or how information is disseminated. Now, we've been really lucky in that we've had a fantastic and engaged PPIE panel who all have lived experience of never smoking lung cancer. They've helped us design our participation information sheets and consent forms. They've helped us discuss the sort of ethical considerations around the study, and crucially, they've helped us try and maximise inclusivity and reach of the study.